Nearly 8 million children across the world lost a parent or primary caregiver to COVID-19 from 2020 to 2021. 2 of 3 households with children globally lost income during the COVID-19 pandemic.
I declare COVID-19 over as a global health emergency.
4 years ago, on March 11, 2020, the World Health Organization declared COVID-19 a global pandemic. The coronavirus pandemic was the biggest health crisis since the Spanish flu and the HIV/AIDS epidemic. More than 703 million people were infected with the virus, and of these, 20 million people died. But these are just the official figures. The actual estimate could be much more. The pandemic spared no one: men, women, children, and the elderly. So what went wrong? Government response, people's ignorance in adhering to safety measures, or a delay in declaring coronavirus a health crisis? Let's decode this. Let's cut to December 2019. People in the Chinese city of Wuhan were getting infected with a mysterious type of pneumonia, and these infections were later found out to be cases of the suspected SARS coronavirus. Dr. Li Wenliang, a Chinese ophthalmologist, warned his colleagues about early coronavirus cases in Wuhan. Dr. Wenliang became the whistleblower of this health crisis, but unfortunately died at the age of 33 after getting infected with the virus. Most of the early infections in Wuhan were linked to people visiting the Huanan seafood market, which became the epicenter of the virus, which then rapidly started spreading to the rest of the world. Now, there are many theories related to how the virus originated. Most medical experts have said that COVID-19 is of zoonotic origin. However, there have been reports that the virus might have been leaked from a laboratory or was developed as a biological weapon. When cases of COVID-19 started spreading outside China, the majority of the countries responded quickly through non-pharmaceutical interventions. These were wearing of masks, regular sanitization of hands, using hand sanitizers or soaps, maintaining social distancing, and seek immediate medical help in case of any symptoms. However, there was a lack of public health infrastructure: beds to accommodate patients, machinery to treat them, medicines, oxygen cylinders, oximeters, and the list goes on and on. There were massive protests in several countries over their government's handling of the coronavirus pandemic. Several politicians, ministers, and political advisors stepped down from their posts due to the pandemic. China faced severe backlash for not issuing timely warnings about the virus. In India, the central government as well as the state governments initially downplayed the threat of COVID-19. 2 religious congregations, the Tablighi Jamaat in 2020 and the Kumbh Mela in 2021, caused a massive spike in infections. The first wave in India was still manageable, but the second wave brought India's health system down to its knees. Vaccination became one of the most important aspects of combating COVID. Pharma giants started manufacturing vaccines of single and double doses, which became instant hits. As vaccine production ramped up, developed and developing countries launched initiatives to deliver the jabs to the poorest of countries. However, the consignments were not enough due to limited government budgets. Pharma giants, including Pfizer, BioNTech, and Moderna, made profits every second, while a majority of the poorest countries remained unvaccinated. 4 years later, COVID-19 has ended as a public health emergency, but it isn't completely eradicated. As countries recover from the medical and economic complications of the pandemic, will they be better prepared for any such health crisis in future? Or will this vicious cycle repeat? Share your thoughts in the comments.